This is the Dr. Berg Show. Live from the nation's capital, it's time to get healthy, lose weight, and feel great. Call now to speak with Dr. Berg at 866-561-4292. And now, Dr. Eric Berg.
Hey guys, it's Friday and now it's 11 o'clock, so we can actually catch up with some of the people in California. So you didn't have to get up too early. Hopefully you're good with that. But if you want to call in, we'll take your calls at 866-561-4292. And we have Karen here that's going to be checking social media for your questions. So we're going to take the first caller from Fort Lauderdale, Gilma. Go ahead, you're on the air.
Good morning, Dr. Berg.
Good morning.
Let me tell you how much I appreciate you. I lost about 30 pounds on the ketogenic diet.
Right.
I'm 50 years old, and I thought I was never going to be size 2 again. So I'm doing wonderful, but I ran into a few bumps on the road, and one of them is cataracts.
Right.
I read somewhere that saturated fat would cause cataracts. I was wondering if I should get the surgery or if it's reversible.
Good
What
question.
are your thoughts on this?
Good question. So let me just answer that. Cataracts are usually stemming from a severe B1 deficiency. And B1 deficiencies occur when you consume a lot of carbs, if you have insulin resistance. So before you get surgery, and by the way, I'm not recommending any medical advice, I'm just giving you information to think with and do your own research. But the point is that you may want to try consuming a lot more B1 right now to see if that condition improves. I'm not saying it will, but it might. But get the nutritional yeast unfortified to do that and see if that can help you. But that's really what I would do. It's vitamin B1 in the complex of nutritional yeast. And that's a good question, though. Hey, Juan, you're from New York City. You had a question about cholesterol.
Yes. Hi. Good morning.
Good morning.
Thank you so much for what you do, and thank you for educating us.
Oh, you're welcome.
I've always had high cholesterol in the numbers of 240. Never followed a diet. I followed your program for 4 months. I do intermittent fasting along with the keto diet. Mm-hmm. I've been doing it for 4 months, lost 26 pounds. I went to a cardiologist and had my blood drawn, and my cholesterol went up to 318. Mm-hmm. And what they want to do is they want to put me on a cholesterol drug called Repatha. Mm-hmm. Is that something that happens with the diet where your cholesterol tends to go up? Because I've been following the ketogenic diet exactly how you have taught us to.
Right. Good question. Can you tell me what your triglycerides are and also LDL and HDL? Is that out of control or just the total cholesterol?
That's total cholesterol. My VLDL is 16. My triglycerides is 114.
Okay.
And my HLDL is 45.
Okay. All right. So a couple things. The other thing I would go get measured is your A1C, because if that's coming down to close to like 5.5, 5, then you're in really good shape. Because here's the thing: your fat cells are composed of triglycerides and cholesterol. So when you are in fat burning, guess what? That has to be mobilized and released from the fat cell. So all that fat has to come out through the fat cell, through your blood, through your liver, and of course your cholesterol is going to spike temporarily. Happens with everyone because you have to get the cholesterol out. And that's why one of the problems with going on the keto is that some people can get a fatty liver because the mobilization of fat and cholesterol comes out if they're not consuming enough vegetables. So as long as your vegetables are high and you're doing apple cider vinegar and you're not doing any sugars, I would give it more time because it has to come out. It's going to come down. See, your body makes a lot of cholesterol. It makes about 3,000 milligrams. That's pretty much 90% of all the cholesterol in your body is made by your body. Only 10% comes from the diet. So we need cholesterol. for the vision, for the skin, for the brain, for the nervous system, for your hormones. So the real problem is not the cholesterol, it's the arteries that are damaged that then the cholesterol comes and starts sticking on the wall. That's where the damage is. And that comes from insulin resistance. So what you're doing is you're actually correcting insulin resistance, you're healing, make sure you do intermittent fasting, spike the vegetables, and I would get it reevaluated in a month and then another month and see if it gets improved. But it will start coming down. This happens just with everyone. And then watch my videos on cholesterol because I think that would be very important. But I'm glad you brought that up, Juan. All right, Karen, let's go to you. Do you have any questions today?
Yes, I have a great question on how keto diet can help someone with an eating disorder.
Oh, okay, good. So let's answer that. When you have anorexia, bulimic, you're bulimic, obviously, you know, usually you're going to be binging on carbs and then you're going to be, you know, getting rid of the carbs, and that creates a tremendous amount of stress on the liver. And it's very damaging. And I guess the purpose is to lose weight, which never works when you're doing the carbs and you're trying to do this. So honestly, I would greatly advise that person to do the keto intermittent fasting to the point where you're doing it at 2 meals. Because once you actually get into true fat burning, your brain is going to function so much better. And it's going to actually, your mood, your cognitive and your mood is going to come up. And it's going to help you cope with those impulses a lot better than running on the blood sugars, which is up and down. So you'll actually experience a lot less stress. The brain will be under a lot less stress, and you'll actually feel better overall. And also you'll be able to control your own metabolism, because what's going to happen over time, that condition is going to slow your metabolism to the point where no matter what you do, you just keep gaining weight. So yes, I would highly recommend it, but do it healthily. Make sure you're getting your nutrients and cut the carbs out. All right? Is that sufficient?
Yeah, that's great. You just gave me the floor, so I'm going to give you another one.
I thought you were going to give me one.
Okay. What about vertigo and the keto diet?
Yeah, vertigo, you know, you're dizzy. It really depends if you get up fast and you're dizzy versus you're dizzy all the time. If you get up fast and you're disoriented or you actually get dizzy, that is an adrenal weakness, because the blood pressure is not adapting to the positional change. Like there's not enough blood and oxygen to your brain, so it takes a little bit to reset. So if that's the problem, you need to support the adrenal glands. I have a lot of videos on what to do with that, but that's adrenal. But let's say you're dizzy all the time, and it has nothing to do with going up a flight of stairs or standing up quickly. That usually is the mucus on the inside of the ear coming from either something you're eating that you're allergic to or some type of sinus issue in the inner ear. I have another video on that as well. 2 remedies for that would be oregano oil. You can take it orally and also put a drop with garlic in the ear itself each day, and that will actually help any type of, like, you know, extra growth of microbes that are in there. And also a neti pot with salt would be really good as well. All right? Let's take a question from Arlene. You're from Delaware. You had a question about your test results and your sleep aid.
Yes. How are you today?
Great, thanks.
I'm talking to you every week.
Yeah, you are.
I got my lab test from urine test, and it says ketos 2+ abnormal. What does that mean?
Well, that means that you have ketones in your urine. You're doing urine, right, or blood?
That was urine.
Yeah.
I'm doing both. I have a question on the blood one too, but the urine one says 2+ abnormal, and then my blood work is the AST. It says 11, which says low, and then it says AG ratio, which is 0.9, and that says low. And I don't know what this is. This is neutrophils. Yeah. And that one is really high, 75.2, and the lymphocytes, that's 14.9, and they say that's low. Now, I did have breast cancer. Does that have anything to do with cancer?
Well, let me just answer that, Arlene. When we're evaluating your blood on the air, it's probably going to be a more in-depth conversation. I need to get your history and all that. But just in general, when you have 2 plus ketones in your urine, that means you're in ketosis. If you don't have ketones in your blood, that could mean you're utilizing them as fuel, but I don't think you actually had your ketones tested in your blood. I think they checked at other things. Neutrophils could mean several things. Number one, it could be weak adrenals, it could be an infection, it could be a low immune system. If you're not experiencing those symptoms, then I think it's probably adrenal issues that you need to check out and start to kind of read up on that. Neutrophils are white blood cells, and so what happens, the adrenal hormone called cortisol tends to suppress the white blood cells and neutrophils. And neutrophils go in there and they eat up and they dismantle microbes, bad microbes. So when actually, if it's too high, it's overreacting, and it could be because you don't have enough adrenal hormone, so it's going high. If it's too low, you can have too much adrenal hormone. So it's a little confusing, and I think for that question, it might be good just to get a whole history and maybe send into my office, and so we can evaluate that. But let's take another question, because we have a lot of people that are calling in right now. Zoeth, you're from Puerto Rico. Go ahead. You had a question.
Yeah, good evening, Dr. Berg. I was wondering, me and my wife, we are professional athletes, and we are having in mind to compete probably next year in a bodybuilding competition. Uh-huh. And actually, it's 2 questions. We were wondering if we can use the ketogenic diet to, lower our body fat levels to essential fat, competition level. Mm-hmm. And also, my second question would be if we can use the ketogenic diet to help us create more stamina in HIIT training exercises.
Oh, good. Good question. Hands down, it is the best thing to do for losing weight, becoming lean, way better than the carbo loading. You may need to adjust your fats a little bit lower right during the competition, but overall, it's the healthiest way to do this. So many bodybuilders end up with issues and problems down the road because they, it's the cyclic carb loading, and then you're working out, and the stress, it really can throw off your hormones, especially growth hormone, and affect your muscle density. But intermittent fasting will preserve your proteins and your muscle. So it's exactly what you need to do. And as far as performance and endurance and stamina, oh my gosh, you're going to have way more energy. Running your body on fat fuel gives you way more energy than running your body on glucose. I mean, you have an average non-obese person has about 70,000 calories of fat to run on. And you only have about 1,700 calories of glucose that are stored to run on. So let's see, which one would be better? Total ketosis, I would jump into that right away, and I think you'll have the unfair advantage of dominating your competition. Good. Do we have any questions, Karen, coming in?
Yes. I reserve the right to ask several here. So one, although we address it every single week, and I know there are videos on this, you have videos on it, but hair loss during keto. Okay. Always get a flurry of questions on that, so you can address that and come back.
Okay. So hair loss. If you're doing keto and all of a sudden you get your hairs falling out, that usually is a B vitamin deficiency. Okay, it's B vitamin deficiency. You use more B vitamins when you're in the ketogenic diet. That's why I recommend taking nutritional yeast or nutritional yeast tablets. And so that's all you need to do is add the B vitamins in there, and that should stop it like that. Okay, that's really what's going to happen. There's no other, it's pretty much going to work about 100% of the time, but you just need more B vitamins.
But is there a magic formula? Is there another a secret you're not telling us?
Oh, you mean related to that?
We want the secret.
Well, that's more for the advanced people, or no, that's more for the advanced show after we do this, the second show. I get into the advanced things and the secrets.
The secrets, okay. Yeah. Okay, good. Now, here's another good question is, what about keto for memory loss or these other issues like dementia related?
I just forgot about that, that's right. Now, keto for memory loss and cognitive function, oh my God, it's incredible. Why? Because, first of all, your brain loves ketones, and secondly, when you do intermittent fasting with that and you cut your carbs down, you actually can improve dementia and Parkinson's symptoms and Alzheimer's symptoms. Why? Because this eating plan is neuroprotective. In other words, it protects the loss of brain cells. You can actually regenerate brain cells. You can get more new brain cells. Who wouldn't want an extra brain cell here and there? I mean, it's beneficial.
Looking for new brain cells.
And not only that, intermittent fasting and the autophagy, that's the word that talks about your cells being a self-cleaning oven. That actually can clean up and recycle and clean itself up. And
I like that.
When it does that, guess what? That's very neuroprotective as well. So you're actually growing new brain tissue back. So some people could actually benefit from that more than others.
Good. So in addition to saying I'm cleaning my oven, I can say I'm cleaning my brain cells?
You're cleaning your self-cleaning oven of your brain cells.
Okay.
You're getting the junk out of the trunk.
Okay, good.
Yeah.
Good. See, I want to let, no. I have to let people on Facebook know because it's changed. With the keto course, it's changed this week to make it even easier. So anybody that makes a comment on Facebook, if you've never made a comment before, you will automatically get an invitation for the keto course.
It's a free course. It's 3 simple videos. Everyone needs to take it. And the reason why I put it out there is so everyone gets the basics, because that's what you need to start with, is the simple basics. Just sign up, take the course.
Yeah.
Okay, good. Now can I go to the next person?
I wish you would answer the phone.
Okay, so Nancy, you're from New Jersey. You had a question about several things. Go ahead.
Hi, yes. Hi, Dr. Berg and Karen. Thank you for taking my call. I have a 55-year-old male here who had the lap band surgery done. It didn't, quote unquote, take. It was apparently removed, and then he found another physician who was willing to do the bypass. He had the bypass done. He's lost way too much weight. He would like to gain more weight and seem like he can't. He recently was admitted to the hospital for bowel obstruction. He's got enlarged prostate and anemia, and no muscle tone. There's also room for concern that he may have some abdominal scar tissue. That's number one. Number two is in regards to myself. I have Epstein-Barr, high prolactin level. I'm about 40 pounds overweight, and my menstrual cycle is very intermittent. Although I just had a very high stress. I lost my father. Sunday will be a year. So I won't get my period for maybe 3 or 4 months, and then I'd get it, and then I get it in 2 more weeks, and then another week, and then I won't get it for another several months.
What's your age, Nancy?
I'm 51.
51? And then as far as your husband goes, he had bariatric surgery, right?
Yeah.
And did you say that they tried to reverse it?
Apparently, this is before I even met him, but he had the lap band, quote unquote, as in his words, it didn't take.
Okay, got
So they went back in, and they were supposed to remove the lap band.
Okay.
And then when they moved it, and he found another physician who was willing to go back in and do the bypass, and when that physician went in and did the bypass, he told him that they never actually removed the lap band, that it was kind of still floating in his system.
Okay. So here's the question I have for you. Are either one of you doing kind of some of the recommendations like keto and intermittent fasting yet?
Yeah, I'm basically am. He still eats like Ezekiel bread and stuff like that every so often, because I really didn't know what else to do with him to help him gain weight. But now with this most recent, he was admitted to the hospital on Thanksgiving for bowel obstruction. Now I'm wondering whether or not he really should have any type of carbs at all, but he wants to gain weight. So I'm very confused what to do with him.
All right. So, well, here's the thing. I'm sure in the hospital he'll be eating some really good food, so that we can rule that out. No, just kidding. Here's the thing with him. I think I would focus a lot on intermittent fasting with him, because that's going to really heal anything going on with the digestive system. As far as trying to gain weight with carbs, I think it's going to send him backwards. I think what I would do is try to get him healthy and work on his digestive system, because apparently there was a lot of trauma in there. When you do bariatric procedures, you lose the surface of the absorption in your stomach or the small intestine. So then you start losing bile and stomach acids, and you become anemic, and then you have problems with trace minerals and proteins. So I have a video on that. You should just watch that on bariatric surgery and keto. I would actually watch that because that'll give you all the data. But I would put him on intermittent fasting big time. I think that would help. Now, as far as your situation with, I think it's a combination of stress, and that's affecting your cycles. Of course, you're 51, so you're going right into that time where your ovaries are going in retirement right now. So it doesn't surprise me that you're not having your period. It's probably a natural transition. But for you, I think what I would do, the biggest thing is support the adrenals. So watch the videos on supporting adrenals with certain tweaks with food, physical acupressure techniques for your adrenals, long walks right now. That's what you need more than anything, because the adrenals are the backup to the ovaries. So you're right into that menopausal where you need to support the adrenals. So that's what I would focus on. Thanks, Nancy. Hey, Brooke, you're from Tennessee. You had a question about allergies to bee stings.
Yes. Hello. Good morning, Dr. Berg.
Good morning.
I also had 2 more questions. But what causes people to be allergic to bee stings, and is there a way to stop the reactions to that without getting some kind of vaccine?
Right.
And what's the difference in fructose in high fructose corn syrup and fruit?
Okay.
Is it just as bad for you? And does it matter what side you lay on to take your blood pressure, really?
Okay. All right. So, so as far as checking your blood sugar, blood pressure, I would do it sitting, and I wouldn't necessarily lay on one side or the other. I would just do it sitting so you're neutral. I mean, you could be laying down too, but not on your side, because it's going to affect the way the heart is and the way the liver is going to compress the heart. As far as high fructose corn syrup and fruit, I just released a video. I'm going to suggest you watch that. But in thumbnail sketch, fruit has fiber and it has nutrients. High fructose corn syrup has no fiber and no nutrients, and it's made out of corn, not fruit. So high fructose corn syrup is by far the worst thing you can, almost the worst thing you can consume for turning into insulin resistance and eventually diabetes, because it's going to go right to the liver, create a fatty liver, and create all the issues. But believe it or not, there is one thing in addition to high fructose corn syrup that I'm going to do a video on this. I found it actually will cause more insulin resistance than high fructose corn syrup. Can you take a wild guess, Karen, what that could be?
Say that again. I was reading.
I know. What is worse than high fructose corn syrup as far as causing insulin resistance?
I know this. High fructose corn syrup and protein?
No, like what else would cause insulin resistance that's worse than consuming high fructose corn syrup?
Cotton candy.
Okay, well, you're right. No, that's actually from high fructose corn syrup. It's actually, believe it or not,
I only got one guess.
Yeah, you only got one guess.
Okay.
It's actually soy oil. GMO soy oil.
We're gonna get the haters now.
Well, here's the thing. I'm gonna do a whole video, and I was like amazed, but then it made a lot of sense, because if you see day coincidence with obesity and diabetes, it goes up right when they started making the soy oil. So anyway,
why is that? That doesn't make sense. Like, we're talking about sugar.
Well, first of all,
we're talking about carbs, and now you throw in soy oil.
It's genetically modified. That means it has glyphosate. It has chemicals. Those chemicals are bad for you. Okay, that's one. Number two.
In summary, those chemicals are bad for you.
Yeah, and number two.
No, I appreciate that.
The omega-3 oils. It's not omega-3. I'm sorry, omega-6 oils are very inflammatory. So, but I think it's the GMO stuff. Anyway, let me get back to Brooke's question about allergies, bee stings. Why would you develop an allergy? That has to do with something that kind of got into the system, and now your body's producing antibodies. What sets you up for allergies is usually an adrenal weakness, and so there had to have been some pre-existing adrenal weakness for you to set up that allergy. So that's really what's behind allergies. Now, a couple things that you can do to improve it as a remedy, and You can search this out. It's a standard process product. Look online. It's called Cal-Amo. C-A-L-A-M-O. Cal-Amo, and it's calcium chloride. Okay, and it actually helps to drop the pH a little bit and helps to reduce histamine reactions, especially bee stings. And I think that was all your questions. But thanks for calling in. Hey, Kat, you're from New York. You had a question about Gallbladder Formula.
Hi, Dr. Berg. Hi, Karen.
Hi.
Hi. I just have a question, a quick question. I know you have a lot of calls. I don't have my gallbladder anymore, and I've been doing keto since October 1st, so we're at 2 months now.
Okay.
And I've only lost 7 pounds. So I just got your Gallbladder Formula, and I'm just wondering if your Gallbladder Formula will help my body convert T3 to T4.
Okay, good question. So what you need to do is find out where they took your gallbladder and get it back and just replace or get it replaced. No, you can't do that. Now what happens when they remove the gallbladder, that means that now you don't have a sac to concentrate the bile as much. So now you have a little tube that goes from your liver down the small intestine, so it trickles down there. So we have a weaker, diluted, less amount of bile. Bile helps you extract fat-soluble nutrients and essential fatty acids and a whole bunch of other things. So you're taking the Gallbladder Formula, which has bile in it, which is great. I would take that after the meal, okay? And also, it'll give you more bile, which is needed to convert thyroid from inactive T4 to T3. So it should actually improve the thyroid function. And that's why when you have a client with hyperthyroid, they have too much thyroid hormones, you don't want to give them the bile formula because it'll make more hormone, okay, or more activation of the hormones that they have. All right? And thanks for calling. All right, Karen.
Yeah,
you're up.
Good. I have some cool questions here. One is eating meat necessary on keto? I can't eat cheese or nuts, so how do I get more protein?
Okay. All right.
You want the other one too?
No, let me just take that one at a time.
Okay.
It's really hard to do keto without doing animal proteins simply because trying to get your B12 and vitamin A, and most vegetarian proteins come with carbohydrates. That is the problem. So maybe you do eggs. Maybe if you can't do dairy and you can't do what? What else?
No nuts,
okay,
or
nuts
cheese.
Or dairy. Yeah.
Yeah.
So maybe you're going to have to do a little fish or seafood or eggs. That's what I'm going to recommend. Because
they don't say they can't eat meat. They just say, is it necessary? So I'm not clear if they can.
It's necessary for the amino acid. The reason why you need amino acids or protein is because structurally you have to replace your hair, your nails, your joints, your muscles. Okay, so that has to come somewhere. And meat is the most comprehensive source of high quality amino acids. Okay.
Good.
All right.
Next question. I was a liver donor. Is that an issue? Terrible problem losing weight. No gallbladder.
Okay.
Sad face. Exercise every day. Also been a healthy eater and just started intermittent fasting.
Well, I think you're doing the right thing. Yes, your liver should come back. It does grow back. If you have a little bit, it keeps getting bigger. I don't think you have anything to worry about. But without a gallbladder, you might want to support it with the Gallbladder Formula because now you don't have the bile. And even if there's not a full liver, then that means you're not going to be able to produce enough bile because the liver cells make the bile. So therefore, adding that one after a meal I think would be helpful. Maybe start with just one meal a day as far as taking that. But the intermittent fasting is going to be awesome to help you get into autophagy and to get your organs to work more efficiently, get your body in a health state, and help stimulate growth hormone, which actually will speed up the growth of your liver.
And
Okay.
but she wants to also know about losing weight.
Yeah, well, that's exactly what's going to happen. Is as your liver gets healthier, you're going to start losing more weight. As you get better digestion, you're going to lose more weight. So intermittent fasting and ketosis is the combination that you need to help yourself lose weight. Okay, so now we're going to take a call from Amanda from Michigan. Go ahead.
Hi, yes. I had a question about my kids. I have 2 questions, actually. One is, can my young kids have the wheatgrass juice powder and the electrolyte powder?
How old are they?
My daughter is 3 and my son is 1. And I know, of course, not my doses that I take,
Right.
but I was just curious if they could have that too.
Well, what I would do, because it's a food-based thing, and it's a concentrate and has all the trace minerals, I would give them, if they're that young, probably 1/4 of what you would take in some water, and then that way they're getting a lot of nutrition. So it's not harmful. It's going to be very beneficial. Yeah.
Okay. My second question is actually for my mother. It's kind of lengthy, but she's 50 years old, and she was diagnosed with 12 years ago with relapsing remitting MS. She also doesn't have a gallbladder.
Okay.
She's got 50% corroded arteries, but all her cholesterol came back normal.
Okay.
And she also has, it's a long list, but she also has the arthritis and degenerative spine.
Okay.
And her doctor told her that's from taking so many of her steroid treatments.
Yeah.
And her main question is, she's also on 50,000 IUs of vitamin D3. She just bought your stress kit and your keto kit, Gallbladder Formula, and the vitamin D3 and K2.
Okay.
Can she overdose? She's kind of at a loss because her neurologist told her that she used to recommend the keto diet, but then her patients started getting like strokes. So she recommended my mom go on a very low fat diet.
Yeah. Okay.
So she's kind of getting tossed back and forth.
All right. So let me just answer that, okay? Amanda, this brings up several key points. MS is a autoimmune of the nerve cells. The absolute only thing that's going to help her is going into a diet that gives neural protection or nerve protection, and that would be intermittent fasting and ketosis. Okay, that's number one. There is another diet. You should not do carbs for that at all. That's going to help MS a lot. The second thing is she has artery problems, right? You said hardening of the arteries or a blocked artery or something. Here's the thing. If you look under insulin resistance, okay, or let's just say high insulin in the body, it's called hyperinsulinemia, okay? High insulin, one of the big side effects is, the first side effect is it goes after the arteries, the circulation, and that's why it disrupts the wall of the vessels, and that's what brings in the cholesterol, that brings in the collagen to start creating the clot and the stroking and the heart attack. So really, all these things like stroke, heart attack, aneurysms really come from high insulin, which comes from insulin resistance. Okay, that's how it happens. So what she's doing is going to be very, very good to help reduce the risk of strokes and heart attacks because it's going to heal the inside of that artery. Okay, and that's why with diabetics you get other vascular problems in the eye, the retina, the blood vessels in the eye, and then the kidney, and the blood vessels to the nerves in the fingertips and the toes. So absolutely, hands down. Now, as far as the nutrition, you can't really overdose on the stuff that I'm recommending because they're food concentrates. They're not synthetic. They're not high potency stuff. I think I would have her replace her regular D3 with my K2 and D3 because she needs the K2 to pull out the calcium out of the arteries and the joints for arthritis. But also this eating plan will be wonderful for inflammation and arthritis because that's what it does. Thanks, Amanda. I'm sorry. All right, Karen, you're next.
Okay, good. So first of all, people love you, and everybody's saying hello.
I love them too.
Okay, good. So here's a question about chronic fatigue syndrome.
Yeah.
Talk about that.
Okay. Well, first of all, chronic fatigue is a symptom. Don't ever treat it with a remedy. I had chronic fatigue, and I was trying to find a vitamin to increase my energy. It's a symptom, so the last thing you want to do is start treating it. You want to find out what's underneath it. The first thing to look at is sleep. Are you sleeping? Let's say you are sleeping. How is the quality of sleep? Is that good or bad? It could suck. So that's what you want to fix. So you want to support the sleep.
Don't mince words, Dr. Berg. Just say it.
My sleep sucked, okay? So what happens is what causes sleep problems is several things. One is your bladder at night, which is insulin resistance. It could be stress from the adrenal. It could also be sleep apnea because you're not breathing at night. So all these things need to be looked at to find the underlying reason. But let's say, for example, Karen, that your sleep is okay and you still have chronic fatigue syndrome.
Then what?
There's two things that I found. It could be Epstein-Barr virus, which is sitting in the background, hanging out, being reactivated during times of stress.
What's that?
It's a virus that happens that it kind of goes into the tonsils. Usually you get it from in high school where your tonsils swell up, like mono. And so then years later, it gets reactivated, not as an infection. It comes out of remission as a chronic fatigue syndrome because you're under stress. And stress is the trigger that brings that out of remission, or part of it anyway. Now this might sound weird. This might sound like it's hard to make sense. But there's great acupressure technique that you can do for improving circulation and immune system function. And it's used my massage tool. I may have a video on this.
That sounds weird.
I know, but it works. So you put it in the back of the neck, right underneath the skull, and you lay back on your couch. And I've used this technique so many times in the past, and I wish I would have filmed it because it's like the person goes from fatigue to all of a sudden they just perk right up because it increases circulation. Apparently those nerve points that you trigger are very beneficial. So I think on YouTube you can type Epstein-Barr virus, or no, chronic fatigue syndrome, and watch that video. So that would help you with that. And the other thing, believe it or not, is the gallbladder sometimes can get congested, and that can actually really suck your energy. So watch some videos on that to see if you can see if that's your problem. All right. Dina, you're from Arizona. You had a question. Go ahead.
Hi, Dr. Berg. Karen, happy holidays.
You too.
Thank you. I wanted to know what your thoughts were on HIIT training as far as something like insanity.
Yeah.
I am 35 years old, 150 pounds. I've been staying at this weight since the summer. I would say since about July or August. And I'm doing great so far as getting on keto, actually doing intermittent fasting. I've been doing actually these past 4 days, so I did terrible over Thanksgiving, bone broth and a kale shake, along with the beetroots, everything you kind of explained before, and doing my apple cider vinegar. So I wanted your thoughts on, here's another thing. I'm wondering if my metabolism has slowed because I was once on phendimetrazine. I would say I was on it for about almost a year, and I lost, of course, a lot of weight. I was at like 125 pounds. Then once I stopped, because obviously didn't need it anymore, I've noticed that now it was easier to gain weight. I went through stressful times, and life happened. So this is where I'm at.
Yeah.
I feel like my body's metabolism has changed, and it needs a bit of hardcore something.
Right. Question I have for you, as far as when you work out, when you do inclines, does your legs get heavier?
Not too, because I feel like I've been doing really good on my, I have done a lot of the vitamins that you've talked about, like the sea kelp, the nutritional yeast. I've been doing, I think, the potassium, the 500 milligrams.
Good.
I've been doing that.
Good. What about when you work out? Can you recover fast, or does it take several days to bounce back?
I would say I need like a day or two.
Okay. And how was your sleep?
Oh my gosh, it's gotten so much better. It was really bad. Again, over the summer, like I mentioned, when I gained my weight, it was terrible, stress. So I've been taking like an adrenal support to kind of help calm down my cortisol.
Yeah.
I can tell a difference. My sleep is a whole lot better. It's improved.
Great.
But just recently.
Okay, well let me just give you a couple tips then, okay? Number one, the HIIT programs, high intensity interval training, the insanity. I mean, I think that's a great workout if you could recover. As you get into your 30s and 40s, I mean, you can still do it, but you better give yourself a couple days to recover from it because it's hardcore. So the more intense, the less recovery. So it's really a balance of balancing it out. Like, for example, as far as the frequency per week, I had this guy come in and he was doing high intense interval training every other day, okay, and no weight loss. So I put him at 3 times a week, and it was a little bit of weight loss. I tried it to go to 2 weeks, 2 times per week, and then he lost a little bit more. I said, just for the fun of it, just work out once a week and get more sleep. that's when he lost the most weight. I mean, I was like, wow, that's interesting. So you may want to experiment and exercise a little less to just get more recovery and see if that doesn't tweak things, especially with the adrenal being affected. You can walk on the other days, but if you want to improve weight loss, you want to focus mainly on making sure that you're doing it correctly. Number 2, those nutrients are good with the potassium, will speed it up in the B vitamins. And then you want to make sure your intermittent fasting is, you're not cheating and you're going longer between the eating bouts or the eating windows. The magic so-called sweet spot for intermittent fasting is between 18 and 24 hours, okay, of not eating. So that would be like, let's say, for example, you ate at 12 and then at 6. So that's 6 hours. That gives you 18 hours. That's when you start to really get into fat burning. Okay, that's when you start mobilizing the fat. If you push it a little bit more into 4 hours, so now it's a 4-hour window, you're going to do better, but ultimately that one meal a day is the most hardcore weight loss. So you would eat once a day, and then it gives you like maybe 23.5 hours to get into serious healing of your insulin resistance and fat burning. So that's one thing, and then also apple cider vinegar will help greatly, and vitamin D will help. And then as far as the exercise goes, you know, full body, high intensity, but make sure you focus on the recovery. And I think just give it more time, and so you can heal from that time where you actually did the serious weight loss. All right? Okay, Karen, I'll allow you to ask one last question.
Okay, 7 questions. Number 1. So, well, first of all, I want to say, if you have a question about the gallbladder, definitely check out the video blog because he's got a lot of videos on gallbladder. And the other thing is, if you want the keto course, just commenting on Facebook, you'll get the keto course. And I believe on YouTube, there's a link. Okay, so you don't have to ask, and I mean, you can ask, but if you comment at all on Facebook, you're going to get an invite for the keto course.
Yeah.
I figured that was a little easier. If you don't want it, you don't want it. Okay, so now I lost my train of thought.
As you're thinking about it, let me
say something interesting.
Yeah, well,
for just a second.
I just want to thank everyone. I want to thank everyone for watching these videos and giving me your attention. I really appreciate it. We just hit over 100 million YouTube views with 800,000 subscribers, just under 100,000 Facebook followers. So thank you. I really appreciate it. And if you wouldn't mind sharing it even more, that would be great. Because we want to actually hit above 100,000.
We want to hit.
So spread the word.
1 billion.
Yeah, right. We want to spread the word because it's just going to help people. So I really appreciate that. Now, okay. Karen, did you remember?
Okay, well, I get a lot of questions about all the mood-related things, and I think you touched on that a little bit.
Yep.
But anything else you want to say for the people who are asking about what can change a kid's mood? You know, in schools, sometimes kids end up in a challenging situation because they'll have mood swings, or maybe, you know, how unusual a 7-year-old doesn't sit in his chair without moving for 8 hours. I mean, some of that's just ridiculous, but some of it's the food they're eating.
Yeah, let me just touch on that, but I do want to say this one little thing.
Just one.
I want to just mention, everything that I say is not meant to diagnose or give you medical advice. It's just meant for entertainment and education, for you to do your own research, okay?
Yeah.
So when I say a remedy or do this, do your own research, check with your doctor before doing this information, okay? All right, that said, here's the cure for cancer. No, I'm just kidding. The mood swings are totally a blood sugar thing. It's hypoglycemia. When it goes low, a person can even become a psychotic. I mean, like, low blood sugars can cause people to do crazy things. So, you know, you imagine how much, like, soda, even kids. I think even in DC, there was an average child. No, 78% of all the children in this study could not go for more than 7 days without a soda. I was like, what? So it's sugar. It's the sugar, and of course, you load up the kids with sugar, and they're not going to sit in their chair. They're not going to be able to concentrate. And then, of course, they're going to be put on drugs. So it's a blood sugar thing. So yes, I'm going to be doing more information on that for sure.
Yeah, definitely do your homework. Okay. Do your homework on the problems and do your homework on any remedy that anybody suggests. That's my 2 cents.
Okay, let's take Tom from Florida. You had a question.
Thank you, Dr. Berg and Karen.
Sure.
They say that tumors cannot grow in an alkaline environment. And so I was thinking that having a benign brain tumor, that it would be a good idea to drink lemon juice and baking soda at night to try to alkalinize my body a little bit more. Is that, according to your understanding? I thought that my diet was acidifying my body, probably. Yeah. Coffee and meats and so forth included. But I'm on keto now, 57 years old, done a lot of water-only fasting, and it's what God used to really keep me alive.
Awesome.
And I've had seizures. I have had seizures from this tumor, but I refused the conventional treatments, thank God, and it's been many years. But thank you for the keto advice. After listening to you, I went back on I had tried the keto, but my wife and I are both on keto, and we're very thankful for your advice.
Oh, my pleasure. I want to give you a couple tips, Tom, okay?
Yes, sir.
Okay. So here's this concept that's pushed out there that we need to alkalize our body because only cancer and tumors can only grow in an acidic environment. They can't grow in an alkaline environment. Well, then how do you explain diabetics that have ketoacidosis? They're all acid, okay? They get tumors, they get cancer. I mean, it's actually even spikes. So basically, and someday I'm going to find out who they is. Actually, I did find out who they is, and I'm going to do a video on that sometime, but I'm not going to tell you who that is right now. But tumors can grow in an acid environment, and they can grow in an alkaline environment. That's not the big factor. That's not the environment. Tumors are triggered by several things, by chemicals in the environment, by there's actually by estrogen that can grow tumors, and insulin is another trigger for tumors. If I had a tumor, what I would do is I would do exactly what you're doing right now, which is keto and intermittent fasting. I think that would be the best thing, but I also would seek help for iodine, because iodine actually helps balance out estrogen, which could be connected to that, and B1. Apparently, when you're B1 deficient, tumors grow a little faster. So make sure you take a little more nutritional yeast or in a tablet to actually help counter that. All right? And then one last thing, I almost forgot, Karen. There's this concept that we all need to alkalize our body. Anyone who says that does not, or just let's say they have a huge confusion about pH. Because your body has about 18 different pHs, okay? Going from severe acid to very alkaline. So the stomach should be acid, the large bowel should be acid, the blood should be alkaline. So when people say to alkalize the body, what are they talking about? What part of the body? If your whole body was alkaline, you'd probably be dead now, because you need the pH differences in the different parts of the body to activate enzymes, to create flows of fluid that go from the stomach to the small intestine. So it's false information that we need to alkalize our body. So it depends. We just need to eat healthy, and then our body will go into the pH it needs to be. That's how you do it. Of course, you want to consume a lot of vegetables, but not necessarily to alkalize yourself. Now, if you're a diabetic, you are going to become more acid, but again, I'm not recommending keto without 7 to 10 cups of vegetables to offset some of that acid. So again, just I have some videos on that you can watch. Thanks, Tom. Okay, Karen, you got a question.
Yes, so a point on sleep. 8 hours is a good amount of sleep. What if a person sleeps 6 hours and then is up and then sleeps 2 hours or 4 and 4, or how does
Good question. Okay.
That's a good one.
Good. Let me take another question here. No, just kidding. So when you actually sleep 6 hours compared to 8 hours and you take naps, it really doesn't make a difference. You can do 6 hours and a nap to make up the damage or make up the difference. It is not a problem. You will catch up. You can catch up your sleep. Take naps. I mean, sometimes when I have a lot to do, I'll get up early and I will take a nap in the middle of the day, a power nap. Bam, I'm out, and I come back in, I'm good. So yeah, napping is totally fine.
But what about with, you say you have to sleep in order to burn fat.
Right.
And you have to get in the zone, and that's when you burn your fat. So how are you going to do that when you interrupt your sleep all the time?
You take a nap.
I can burn my fat when I'm napping.
Yeah.
Okay, good.
Yep.
Fair
all right, Barbara, you're from Ontario. You have a question.
Yes, Dr. Berg. Thank you for taking my call.
Sure.
I ate by the way of Mark Hyman's 10-day detox diet for a while, for 6 months, and then I came on board with keto and intermittent fasting. I have your book and been reading that. I was on Lipitor for a couple of years due to high cholesterol diagnosis, and I heard just too many crazy things about Lipitor, excuse me, that I decided I wanted to get off of it. My doctor wasn't in favor of that, but I personally decided to stop taking the Lipitor on my own. I had a recent blood test, and my LDL has gone up. Should I go back on the Lipitor? Will staying on the Lipitor until it balances out be the best move?
Okay.
I can give you my levels from last year to this year.
Well, let me just answer that because I don't even need the levels. I'll just give you the answer of my opinion. Of course, I can't ever tell someone to come off medication, but let's just say you were my sister. Okay, what I would probably talk to you about, I would educate you on really what LDL is. It's not even cholesterol. It's low-density lipoprotein, because cholesterol is type of a fatty thing, and your body is more water. So it can't move without a little shuttle, a little truck. So the LDL and HDL are little trucks that carry the cholesterol through the body. And LDL has some really important purposes. Your body makes LDL. So the problem is the artery damage or the inflammatory damage in the circulation that then will cause the LDL to stick. Okay? And it's and you should watch all 4 of my videos on LDL, because that would give you the whole scoop. There's so many people that take Lipitor that end up with all these side effects, and the effectiveness of that is not as high as you think. And that's all I'm going to say about that. You can research it, but Lipitor basically cuts down the function or the production of cholesterol systemically. Well, your body makes 3,000 milligrams. Well, now we're going to basically cut down the production of the hormones, the nervous system, the brain. I mean, we have to ask why our body is making this high cholesterol. It's there for a reason. It's trying to heal something. It's acting as a Band-Aid. As long as you focus on the underlying real reason for it sticking and clogging, which is high insulin, and focus on that, you're going to be in really good shape. So that's what I would do. I would focus on lowering insulin. There's a whole bunch of things you can do, because insulin resistance, really what's causing that is high insulin, because it's compensating. So when the body then fails to compensate, then you become a diabetic. So you just need to lower insulin and then give it some time, and you'll probably see your cholesterol levels come down real nice. And also, one last thing, you might be able to get some natural remedies for the liver and support the liver directly. Sometimes that also helps. All right, try that, Barbara. All right, Karen.
Yep.
Quick question.
Okay, take another call.
All right, good. We're going to take a call from Tara, Los Angeles. Go ahead, you're on the air.
Good morning, Dr. Berg. Good morning, Karen. Good morning. Thank you so much for everything you do. You have saved my life, and specifically my stomach. I was scheduled for a gastric bypass surgery at Cedars-Sinai in Los Angeles with, I can honestly say, the best surgeon in town. And I found you accidentally on YouTube 2 weeks before my surgery. I canceled the surgery, even though I had all the blood tests, everything done. I have lost 54 pounds already and counting, doing intermittent fasting and ketogenic diet, eating one meal a day, and I'm following your instructions to the T. I'm a huge fan. I have a couple of quick questions. One is, I blend my vegetables in apple cider vinegar because, you know, you have to add some kind of liquid to do the blending. And then I freeze a whole bunch of them in the freezer and then use a good portion from the refrigerator. I'm always concerned that the apple cider vinegar might kill the enzymes. And so would that be a consideration? Because I've been doing this a long time from the beginning, because I really can't go to the store every day, and I go to the farmer's market. I've been eating very clean and organic. And what about the yellow teeth? Because my teeth have turned yellow. And so from the apple cider vinegar. Another thing is, Dr. Berg, is even though I eat a lot of green vegetables, because I'm eating one meal a day, I supplement with potassium citrate and magnesium citrate daily from the beginning. And I was wondering if this may be harmful. I buy the box supplement, so there is nothing added. It's just the pure potassium citrate. And I just take what the dosage is instructed on there. But I keep wondering if that may be harmful. So would you please let me know about that? I really appreciate it. Thank you, and God bless you.
You're welcome. Okay. Tara, here's a couple things. Number one, no, the apple cider vinegar will not destroy the enzymes. What destroys the enzymes is heating the vegetable, okay? So as long as you don't heat it, you can freeze it. It brings it down a little bit in nutrition, but it's not that much. I think freezing is the best bet for you if you can't preserve the vegetable. One thing that I do, I go to Trader Joe's and I buy this cleaned organic chopped kale, and I bring it home, stick it in the freezer. We have tons of frozen kale. It lasts months. Okay, then we take the kale, blend it, put some stevia in there, little wheatgrass juice powder, little electrolytes in there, which is actually the potassium citrate and the magnesium citrate in my electrolyte mix, and that's totally fine. It's not a problem at all. In fact, it'll actually help prevent kidney stones and drops uric acid levels. So that's totally fine. So you can blend that drink and drink it, go from a frozen state to a liquid, and you can drink it. That's how you can get your vegetables. So no, I wouldn't worry about that at all. As far as apple cider vinegar, you might want to start drinking it with a straw. I don't know if the acid would color the teeth more than it might erode the enamel, possibly if you let it swish in your mouth too long. So use the straw, but I don't know what's causing that yellowness. But thanks for your question, and I'm so glad that you were able to lose that weight. That is awesome.
Well done. That is amazing.
Awesome. All right. Karen, you got a question? Yeah.
Yeah, well, I'm getting a lot of questions about medications. Now, you're not a medical doctor.
No.
And you can't make any medical recommendations.
No.
And you can't state anything about anybody's medical scene or the drugs they're taking.
No.
But a lot of people are asking questions about doing keto or maybe taking certain supplements while they're on some kind of drug protocol.
Okay.
And sometimes, sometimes we hear this. People say, my doctor told me not to take that vitamin, or,
right.
Can I do keto while I'm under this particular protocol? So maybe you can talk a little bit about keto and what effect that might create on meds.
I am not a drug specialist. What I specialize in health. So I'm trying to get people healthy so they can avoid taking excessive medications. As far as the doctors go, I mean, the derivation of doctor means teacher. So your doctor should be teaching you how to be healthy. That's just my viewpoint.
Wow, how many people didn't know that? That is, raise your hand. No, raise your hand. Okay, no, you didn't know that. Your hand's not raised. Okay, go on, Dr. Berg.
Yeah, so teacher, your doctor should be teaching you tips and things of how to create your health versus just managing your diseases with medication to suppress your symptoms, which keep the problem there long term so you never get healthy. Because if you teach someone, then they can actually create their own health. It's a new concept. So that's why we want to educate people and have you spread the word. In fact, you should do that right now if you're on Facebook and YouTube, because we just want to get people to know how to fix it themselves. as far as the doctor gives you advice on something, I mean, if it's not true for you, then it doesn't make sense. Go do your own research. Unfortunately, a lot of doctors tend to miss nutrition in school. They don't give you the full study of that, so they don't have enough data to give you the right answer sometimes when it comes to food therapy and nutrition. Drugs is a whole different story. So that would be my answer. Did I answer that?
I thought that was great.
Okay.
And people are raising their hands. I have a really interesting question here. Someone who's Indian, I don't know if he's from India or just Indian, and they have a staple of rice, and he's eating rice on the keto diet. Your turn.
Yeah. Yeah, the whole confusion that people have with the keto diet is exactly like, what is a keto diet? Is it like high fat? Is it this or that? A ketogenic diet is actually just a low carbohydrate diet. So if you're doing a ketogenic diet with rice, you're not doing a ketogenic diet. You're doing a rice thing. I don't know what that is. So if you're doing ketogenic, that means you're bringing your carbs down to
high carbo diet.
Right.
That's the opposite.
Exactly.
Unketo.
It's the unketo diet. But if you go low on carbs, between 20 and 50, keep your carbs low, then you go into ketosis. So that would be the ketosis diet. So it's not a high fat, it's a low carb. Just happens to be adding the fats in there as the other variable that actually helps you do this program. And there's a lot of other benefits which I'm not going to get into. Now, I forgot to, with the medication that people are on, you know, I would get on the keto and intermittent fasting. There's not any conflicting information there. Get on that, get healthy, then get with your doctors and see if you still need the medication. Because if you look at what insulin resistance creates, high blood pressure, heart disease, kidney disease, inflammation, memory loss, mood challenges, anxiety, depression. I just go lowered immune system, erectile dysfunction. That's another one. I mean, just the list goes on and on and on. So could you imagine if you fixed the core of all those problems, what would happen? When you search on the internet, what comes up is like WebMD, all these different, you know, medical advices, and they're always saying, well, insulin resistance is associated with heart disease and inflammation. No, it's not associated.
Does that mean that you happen to have something at the same time?
It's
or like your neighbor has it?
It's misinformation. They're confusing people. They don't know what causes what. So, and yeah, I don't know if it's an intentional thing or just a real serious lack of knowledge. But let's take a question from Sam. Sam, you had a question. You're from Florida. Go ahead.
Hi, Dr. Berg. Very big fan of you guys, and I love the work you're doing. Great educators in the health. And I wanted to ask a question because I've seen a lot of great results with intermittent fasting and keto. However, my girlfriend has gastritis, and my mother does too. So I was wondering, how can they apply keto and intermittent fasting when the recommendation is that they have to eat frequent meals throughout the day for their gastritis, and also not eating a lot of high-fat meals?
I'm glad that you brought that up, Sam. First of all, gastritis is inflammation of the stomach. Ideally, what you want to do is acidify the stomach, but you can't because it's inflamed. So you're going to have to do kind of a pre-healing step first before you get into acidifying the stomach so it can actually work right and not develop the inflammation in the first place. So the way to do that is use chlorophyll. Wheatgrass juice powder is a really good remedy for that to help heal the inside of the digestive tract. And that's what I would do. And then also you can do intermittent fasting. The combination of ketosis and intermittent fasting drops your inflammation. So anything that has itises, gastritis, bursitis, arthritis, tendinitis, bursitis, all gets improved. So it's the exact thing you need to do. And I think maybe you just don't do the high, I mean, maybe adjust the fats, but I think that would be the best solution for your girlfriend. Thanks, Sam.
Wow, that was fast.
Yeah, wow. Hey guys, well, thank you so much for your wonderful questions. We're going to do this next week, Friday at 11 o'clock in the morning Eastern Standard Time for those California people.
California.
Okay? Have a great weekend.